Welcome to the Let's Talk with Paula show, where we talk about many, many things. And I always have to say, because now, as long as we've been on the air, that was my very first show when I only did one. It was Let's Talk with Paula.
Okay.
And, we had a little bit of everybody that was on there. Dance, well, we still do, but, it was a new thing for people to
So,
be on
Paula, did you
television.
dance also?
No, I did not.
Oh, okay. I was just asking.
No, I'm talking about like interpretive dance.
Oh, okay.
But sing, write books, it's the same things that
Yeah.
we have people now that they were doing it. But film writers and then boxers, I was going, and we were covering the basketball, professional basketball.
Okay.
So we would go up to New York at the time.
Okay.
And we would do the professional basketball when they did March Madness.
Okay.
And then I was following the boxers around, professional boxers. I got pictures with Sugar Ray.
I was about to say, I thought I saw a picture with you with
I
Sugar
showed you
Ray.
with Sugar Ray and
Yeah.
Tommy Hearns.
Yeah.
Yeah, and some other boxers, and then we were doing local boxers that were coming out big. That whole family boxers, the sons here.
So, but the DC area was like really popular for boxing, like what, in the 80s and the 90s?
Yeah, it was really popular.
Yeah.
I mean, everybody came through here,
Yeah.
and people that were from here.
Yeah.
Like the Herd, the young boy Herd now. I think he lives in Baltimore, PG.
Okay.
And it was just a big thing at that time. But anyway, introduce yourself. I'm sorry, I went off on a tangent because this was my first show, and it's almost 20 years now.
Wow.
So whatever. I think that it's good that we've been able to hang in there that long.
20 years.
Yeah, almost. Yeah.
Wow.
So anyway, so they know who you are, but introduce yourself, please.
Well, thank you for having me back on the show. My name is Donald Bell. I'm an attorney here in Maryland. Here in Prince George's County, I want to say I am, this is my home base here in Prince George's County. Mm-hmm. And I've been here over 20 years and hoping to be here another 20 years.
Oh, yeah, hopefully.
Yeah.
But both of us.
Lord willing.
Yeah, Lord willing. And the creek don't rise.
Yes.
Yeah, we'll be all right. Yeah, but the thing that you got to be so dangerous about right now is because they're not really telling people. I mean, people getting text messages about COVID, okay? And then they're actually breaking it down because they're saying that you don't have to get the COVID itself, but the derivatives from it. There's so many things that are a spinoff from it that you could get that'll really make you sick, and it's really contagious. But they haven't mentioned it on the news. So if you didn't see it on the news, because they ain't telling you, okay? Because remember, this is not a popular, COVID's not a popular thing with presidents. I'm going to say presidents, okay?
Yeah.
But
well, it's not just presidents, but it's sort of everybody. I mean, I think people in this country had like a lot of COVID fatigue. We've said that before, but most people want to be out and they want to socialize. They want to be around other folks. They want to be around their family, their friends, and they want to be out and about. And, COVID sort of forced a lot of people, us included, to,
it did. Well, that mask mandate.
To isolate.
Yeah, the mask mandate.
Isolate and wear the mask and things like that.
In the house.
Yeah.
But it's very important because there's a lot of people that are dying from COVID. Yeah. It's a lot of people that are, whatever these spinoffs are, they're getting sick and they're in the hospitals. Some of the hospitals, I know for a fact that it's not a hearsay thing. I know for a fact that some of the hospitals are short of staff because their staff is getting sick, from these COVID or the derivatives from it. Because they said this one is much more contagious, but they don't, I guess they don't want to put people on alert. Like I wore a mask in here, okay? I took it off because it's just the two of us, okay? And I had my COVID shots, and I know you had yours, so I don't mind sitting here with you. But if I'm going into like a Walmart or, places where there are a lot of people, even with my family, if there's a lot of people that are there, I'm going to put a mask on. Okay. I'm going to put a mask on if I go to the hospital, okay?
Understood.
And what they're asking you, because the measles, this is the measles, it's the chickenpox. What are we doing right now?
We were talking about the measles before the show started.
Right.
because that was that's been one of those diseases that's been in the news lately.
Mm-hmm.
You know, because there was someone. I don't think Maryland had a case in a while, but recently,
they have 3 now.
yeah, recently I knew and I saw in the news where somebody had gone overseas and come back.
Yes.
And Maryland had its first case, but now you're saying there may be 3.
Yes. The other
So
night,
measles
night
is
before
highly
last.
contagious.
Yeah, because it is. And so now we have 3 that are here in Maryland.
Yeah, unfortunately,
and I
some
think-
people have not gotten those vaccinations, and so it can be highly contagious, and it can spread like wildfire.
And what they're asking you to do is, if you start getting symptoms and stuff, they're asking you not to just to go over to the emergency room or not to just go to the urgent care. Don't just go to your doctor's office. They call them so that they can prepare you, and when you come, they can put you in an isolated space.
Mhm.
Okay, so they're asking people. This was on the news last night.
Okay.
Don't just show up.
Mhm.
Okay, if you got the symptoms and stuff, call even the hospital. I was surprised. Said call the hospital and tell them that you think you got the symptoms.
But you got to think about it. When you go to an emergency room, that is a place where the sickest of the sick are,
Mm-hmm.
and people who have compromised immune systems.
Mm-hmm.
And some people can't get vaccinations.
Right.
Because they may be allergic to them and things of that nature.
Mm-hmm.
So if somebody with something like measles
Mhm.
or some type of infectious disease comes in that can just be spread just by them coughing or
Or
touching
just sit in the room. Don't have
or
to
just
touch it.
sitting in the room.
Right.
I mean, that thing will spread like wildfire.
Oh, it does. It says it'll get from 9 to 13 people at one time.
Yeah.
And you don't even remember where you are. When you got it, right?
And then you think if one of those, and then those 9 people go somewhere,
Right.
and then that's just how it just multiplies.
Right. And so they're saying that please call the hospital, tell them you got these symptoms so that they can identify you, and they're going to probably tell you to sit in your car, park it when you get there, and then somebody will come out and get you, and they're going to take you to a private area so it's not infected in the emergency room.
I think that's a very smart way of doing
And
things.
also they said the same thing for your doctor's offices. Don't just go to your doctor's office and show up, because that's what you do. You panic. They said no, call your doctor's office, put them on alert so they know what to do. Apparently they're letting the healthcare industry know what to do, and they passed it to the news media so they can tell you what not to do.
But think if somebody comes in with something like, measles or something like that, I would imagine they would have to go in and clean that whole area. And,
Oh yeah,
and
when they
whatnot.
finish.
So yeah,
They do.
yeah.
They do.
So I don't know. I'm not a
Well, they
medical
were doing it.
professional.
They were
so
doing that with COVID.
that's your area of expertise there.
Well, they were doing it with COVID for a minute. Before they could put you in a room where a person had been documented as having COVID.
Yeah.
That they had to clean that room up before they let you go back in there.
Well, my doctor wouldn't even let you come in. She would do it through
on the television, virtual.
Yeah, through virtual. You would have to. I think it was. I think it may have been like WebEx or something like that, where you have to get on.
Yeah.
And then she would talk to you and then give you a prescription or something like that.
Mm-hmm.
But so basically, I remember I was in the car, so she wouldn't even see you. So
Right.
yeah.
Well, it's very important because they said, because it is highly contagious, and they're not mentioning COVID, but people are sending out text messages from different hospitals and letting you know what the symptoms are, and if you know people, that people getting COVID, but it's a different type of COVID this time because it's the different types of things that your family go through. Yeah,
It mutates.
Yes.
Because something gets into my system, it may change because of the way my system is made up, and then if I pass it on to you, it may
do something
mutate
else.
and change in your system.
And then it might, I don't mean to cut you off, but then it could be from the different vaccines that we had. Like you got yours from Johnson & Johnson, or somebody might have got theirs from somebody else. You understand what I'm saying? So when it mutates, maybe that particular booster shot you got wasn't
100%.
covered for that one, But it's out there. So I'm just saying to you, I wore a mask. I have a mask. I wore a mask, and I even take my extra one around sometimes and ask people if they need one. I wore one in here, but like I said, if I'm going to Walmart or I'm going to grocery store or someplace like that, I'm going to make sure that I have a mask with me I'm going to not only with me, but I'm going to have it on while I'm in the store because it is highly contagious. So now we have 3 things that we fighting at one time. Well, is it 3 or is it 4?
Oh,
because they got TB.
What's TB?
Tuberculosis.
Oh, tuberculosis.
Okay, they got that in different areas, right?
Okay.
They got the measles, right?
Okay.
They got COVID, whatever strain that you want to call it. And then it's TB. It's another one. I can't think of what it is right now. It's another one that's out there too. That's in certain parts of the country, and now it's just spreading. Like you said, we just recently.
Well, we had the stomach. We had the stomach flu. That ran rampant through my house like 2 weeks ago. I think my daughter picked it up from the library. It was like a 2-day.
Well, that's part of the strain break off. Is that it actually you will get those virus, and how you know that it's COVID is because it spreads so rapidly. Regular flu, you might get it, nobody else get it in the house if you do what you're supposed to do, right? But this one just runs a little rapid. But there was so many different things that they had put down on this thing that they sent out from Johns Hopkins that was telling you to look out for, to be cautious with. And so I just tell people, if you're going to know you're going to be out, going to the grocery store, going places where they're allowed, even in your own family. When my family's had events and stuff, I make sure that I have a mask on or I don't go.
Yeah. Well, it's getting to that time of year. It's springtime now, so.
Allergies, you can't tell the allergies from whether or not you got, just like the flu season, you can't tell whether it's the flu or COVID.
It's almost barbecue season. So cookout season.
Yeah.
So, you gotta be vigilant.
Yeah. Especially older people.
Yeah. Don't sit at home, but maybe put your mask on.
Yeah.
And going out and
enjoy yourself.
Get you some hand sanitizer.
Yep. And carry it around.
Yeah.
I carry mine around too. That's in my purse too, because that was one thing that the little thing that was going around telling you to look out for COVID, right?
Okay.
I would add to it, please wear a mask.
Okay.
Well, when the second time I got one, and I added, please wear a mask, somebody sent it back to me and said, would you please add, would you wash your hands? Okay. Because that's important,
because your hands, you take your hands, you put them on your face.
Yeah. And I said, I hadn't even thought about that. If you just wash your hands all the time, you're not even going to even think that's something that you got to tell somebody to do. You know what I mean? But I said, okay, so when I start sitting out again, I added, would you wear a mask and would you please wash your hands?
But your hands, you use your hands to touch everything too.
Oh, we do.
So, when you walk in, like a touch,
Yep, and we don't know what it was, or who shot
when you
John.
go to the bathroom or you walk by somewhere, you touch the counter and stuff, you don't know. Or even if you touch the wall or something like that, you touch a doorknob.
Oh, a doorknob is really bad because, if the door shut down, people come through there. I know those people not getting up in their office going out there, not unless they got one that's really
But think about it, you open a
conscious.
Doorknob, and then you're sitting there talking to somebody, or you open a doorknob, and then all of a sudden, you shake somebody's hand, and now you're thinking about something. You put your hand to your face.
Yes.
Guess what?
Yeah. Now you got it, and you don't even remember because that's a normal thing for you to do.
Yeah.
When you, especially if you're getting a businatman like you, you greeting people all the time. So you're not. It's just second nature to shake a hand. You know what I mean? But at least I know you have your sanitizer around.
But unfortunately, I don't meet with as many people in person as I used to before COVID. A lot of meetings now are over the phone or over like video conference. It used to be rare where I would meet people like over the phone or via video. Most people you met, you talk to them over the phone, but the whole purpose of talking to them on the phone was to get them in the office and sit down and meet with them. Right. But COVID changed a lot of that. And
it's going to change a lot more because there's a lot of people that are dying, and they're not mentioning it on the news. There's a lot of people that are out here that are dying. Hospitals are short of staff. If you know somebody that works in a hospital, ask them. Is the hospital short of staff over there where you're working? And so we're not just talking about with the measles. We're also telling you, even if you go to the hospital, wear your mask. When you're going to visit people and stuff.
I think it's imperative. Definitely, you should wear a mask in the hospital, whether you're sick or not.
Right. Right.
If you go into a
Hospital.
hospital, you should probably
Yes.
wear a mask.
Yes.
Because they're probably super bugs in there.
Yes.
Super strains.
Yes.
Yeah.
And so, you know, the staff is getting sick, you know. People are dying, and they're not even telling you that these people are dying, you know. And they putting down on there, because I know somebody that has a funeral home, they put on their death certificate said natural causes.
Mhm.
When they know that they were not from, well, they were doing that the last time too.
Yeah.
Because they didn't want the numbers to be inflated, right?
Mhm.
But, excuse me, right now what we have though is everything is highly contagious. The chicken pox are contagious, okay? And so, you know, we just we had one here, and now we got 3 people.
Oh yeah, you're talking about the measles.
We're talking about the measles. I
Yeah,
keep
yeah.
on getting them confused.
Yeah.
Yeah. There's 3 people now in this area. I think
Okay.
it was either 1 or 2 in D.C., and I think it might have been 1 in Virginia. Well, you know, you multiply that, and if they're going out and they didn't know they had it, you
Yeah.
know,
Because a lot of times you don't know you have it until you start having symptoms.
get the rash.
Yeah.
And then once you get the rash and stuff,
It's too late.
It's too late, right? By that time, you done spread it to 18
Yeah.
people, let's just say, you know. So, and then TB, it's highly contagious, okay? And that's still down there, I think in the southern states. I don't think I've heard anything about it being up here on the news.
Oh, I
in this
haven't heard
area.
anything about
Yeah,
the
but-
tuberculosis.
Yeah,
so.
TB down in the southern states. So they have TB that's running around down there, a few of those states down there. So everything that's out right now is highly contagious, okay? And it's rapid. And if you don't, like I said, a mask is something that's going to keep you alive, okay? And just, you don't have to, like I said, I mean, I know Donald's had shots, I've had shots, you understand what I'm saying? I know the technicians had shots. So I feel comfortable, it's just us in here. And we're about 7 feet apart, I guess.
Okay.
You know, because they still keep that distance, so I feel comfortable, you know. But when I came in the building, because I didn't know who I was going to encounter when I came in the building, I had my mask on.
But one good thing about this building, like this time of the evening, a lot of times
Everybody gone.
everybody's gone.
Mhm.
Every now and then there may be like some type of event or something like that.
Mhm.
But when I walked in this morning, it was just the guard. I mean, this evening it was just it was
always usually it's just a
yeah.
guard, not unless they have an event like you
Yeah.
say. But no, but I don't care. I don't know who I'm coming in crossing paths, so I still wore a mask in the building if I just go in the building. I'm older,
Yeah.
okay, so and I'm not getting another booster, okay. I had my 2 boosters. I'm satisfied with those. That got me through COVID, okay, the last time with the 2.
Okay.
That I'm not getting another booster. I don't know what they're putting in the booster. I don't know if the boosters. No, I ain't gonna say that because somebody ran away with that. I'm not even gonna say it, okay? But it's very concerning though that, you know, they're not mentioning COVID doesn't come out anybody's mouth. Not even flu. Not even the symptoms that they have. It has not come out of anybody's mouth or any one of those news stations. And I I tape them just so I can go back and see what's going on in the news, right? So I missed one, and the first 15 minutes are important on all of them. You know? And so
Usually by the time the news comes on, I'm in my second or third dream.
yeah, but you know what? But you got news in the evening.
Yeah.
They got more news on there nowadays.
Yeah.
I see than they've ever had before, all times of the day.
Yeah.
You know,
You know, I catch the news like on Sunday mornings. I catch the Sunday morning
talk show.
talk shows, but it's very rare that I get to see the news like in the evening times.
Well, I'm gonna tell you something. If you can just tape the first 15 minutes of Stephen Colbert or Seth Meyers,
Okay.
even though they're comedians, they tell you the truth and then they make a joke out of it, okay? But I would have heard it on the news, but I wanted to hear what their spin is on it, okay? That if you could just tape the first 15 minutes of their monologues, they're going to tell you what's going on, okay? And it's like, it was a big thing that's in the news right for the last 3 days, Stephen Colbert. And I don't have stock in Stephen Colbert's show.
And you know, I've never seen the show, so.
You need to tape it, okay?
Yeah.
First 15 minutes.
I've seen like shorts like on social media or something like that, but I've never watched the show.
Right, but you don't have to watch the whole show. I don't watch
Yeah.
the whole show. I watch the first 15 minutes of it, and not unless it's somebody that's a guest that I want to,
Okay.
you know.
So
to hear
so
about
that
it.
comes on late at night?
It comes on at 11:37.
Ooh. You brought it at
11:37.
midnight oil.
But he's on YouTube.
Okay.
You know, so you can catch him on those things. Because the thing that they've talked about the last 3 days on these shows is that, in fact, I have it on. I taped it, but on my phone. But
Okay.
about the. I know you heard about all these executives, the highest chiefs of staffs and all them people getting together, had a meeting over some
Yeah, it was an app.
some app, right?
Yeah, it's a communications app.
and it's not secure.
It's not secure.
And they were talking about bombing Yemen, and they were trying to clean
They were
it up.
bombing the Houthis.
The Houthis, yeah.
Yeah, the Houthis.
In Yemen, in
yeah.
Yemen, the Houthis.
Yeah.
And
So yeah, I think like some of these groups, they're like out in the Middle East, and I think what they're doing is they're terrorizing like ships that are doing like trade throughout that area and whatnot. So and I think they're proxies of Iran from what I understand. And so you know, the United States government decided to bomb them, and you know, the most senior of senior leaders were on a
group call, a chat,
a group chat
group chat
that can be infiltrated by
anybody.
Yeah. And the sad thing about it was, it's one thing to be doing that, but they included an editor from a newspaper who is always highly critical. So I don't know how. I mean, that's just a level of, I don't even know how that even happened.
Well, they say that everybody need to be fired. You know, that's, I don't have nothing to do with that. But I'm just saying that some of the commentators been saying that that whole group needs to be fired. Because
well, I think there should be somebody should hold somebody accountable.
Yeah.
So in terms of firing, I guess that's up to the president and
Well,
whatnot. You know, because they serve at his pleasure.
Yeah.
But you know, but
those are his
they
people,
put
so that I can get
those actions put, you know, American soldiers
at risk. Yes.
The people, the men and women who were carrying out that.
Mm-hmm. And they were trying to say, well, it didn't have any information, so naturally he's going to turn around and put out there.
Well, but the mere fact that you are communicating over a commercial app,
which they already said was a bad app not to use.
Yeah, but you know, on the way over, you know, I listen to Bloomberg.
Okay.
Radio. It's like talk radio. 99.1. I think they even based here in Bowie, from what they say. And so they had someone from the previous couple of administrations on there, and they said that they have secure ways for them to talk to each other.
They should have never been on there. They said and they had discussed about their app not to use it. Yeah. And that, you know, they shouldn't have never been on it. Yeah. And so what was the purpose? And then Goldberg, they keep on trying to make it sound like he, you know, didn't know what he was talking about. Didn't nobody release stuff.
So that's the editor you're talking about now. Okay.
That was on the call.
Okay.
So he actually, because he was on the call the next day too. Yeah. So because somebody else told you, oh, it was good, it was wonderful. Those are not the words they used, but oh yeah, it got done, whatever. So he had specs and everything, when it happened, how it happened, you know, and everything. Yeah. So you can't lie because I was on the call.
I think the appropriate thing to suck all the air out of this, it was to stand up, take accountability for it, say, look, you know, I did this, I shouldn't have done it, we won't do it again, and that's gonna be it. That would have sucked all the air out of it. But when you continue to deny it and say, you know, well, we didn't really discuss anything, and then the next day the editor for the Atlantic puts out like,
bam,
what you talked about.
Right. And then,
you lose credibility.
Yeah.
You lose credibility. But you know what should have happened was, you know, like the Secretary of Defense, like the National Security of all those people should have just stepped. It's like, yeah, we were using it. We should not have used it. You know, luckily no one, no American soldiers lost their lives. And,
that's the apology.
And we're not going to do it again. You know, I'm going to take responsibility for it. We're not going to do it again. And left it at that. And and that would have been it.
The very first day, it was an accident.
Yeah.
But the guy.
But when you deny it, it just creates just a bigger and bigger and bigger story.
But one of the guys bad-mouthed the guy so bad the first night on the news.
So he was like, "I'm gonna publish it now."
You know, and yes, because he had to defend his honor. I said, "Oh, nobody did this," and then they said, "Oh, but then there wasn't nothing like that on." So he said, "Oh, y'all saying it wasn't." So then the next night, so they kept it in the news for 3 days. That's what they did.
And it's just growing bigger and bigger because it just won't come out and take responsibility.
Right.
Because once you take responsibility and you go, I mean, most people are going to be like, okay, people can make a mistake.
Right.
And, you know, that
how many
mistake
times a text messages you accident? I have done that myself. Put somebody on there by accident and had to apologize to you and say, "Oh, that was going to my son." Because I know you're probably looking at it saying, "What?" and you know, accidentally, because he was the last text I had. But you had to add these people's names into the group. You understand what I'm saying?
Yeah.
You know, and so, and then for you not to notice the name the first day, okay.
That you have a reporter or editor that is, you know, that's highly critical of you all.
Yes.
So.
Yes, and so the first night, the guy that was on the call, that was part of the talk, you know, want to bash him so bad, which really made him look bad, because now you lying to the American people straight up, you know, because it's gotten broadcasted now, and you bash this man so bad, and the man has to come back the next day and say, "Oh, nah, here you go. Let me show you." Okay, and then you still want to say, "Oh, no, I ain't know enough about it. I ain't give nobody permission to do that. Oh, we didn't know they was on the phone. Oh, well, you know." So then the man has to bring out some more documents, because they said, "Oh, they didn't have where you were going to be in the area and stuff like that." And they said, he said, "Bam, let me show you this."
So taking accountability and responsibility for your part, you know, goes a long way.
Yes, and so I think that they really need to.
I think that's one of the major, you know, points about being in a leadership position. You know, you got to take responsibility, and you say, "I'm accountable. I'm accountable to the American people. I'm accountable to the president, and I'm going to take responsibility for my part."
And an apology, like you said, to the veterans, okay, that could have got killed. We don't know if anybody got killed or not, you know, but I mean, it's an apology to, and then come back and apologize to the American people, because you have, you know,
but I think if that would have
discredited this man.
I think if that would have been done, that would have sucked the whole air out of this, because
I think so too.
In D.C., so many things are happening.
Right.
People would have moved on to the next thing.
That's right. But they kept it in the news for 3 days, so it's something else going to come out, because there was some more stuff last night, so something else is going to come out. But anyway, my biggest concern right now is for this country, is for us, because our children are going to school, and we need to be. They're trying to take away their education. You know, the Department of Education, they're trying to close down all these. And my heart goes out to all these federal workers and all these people that are losing their jobs. Let me say that. I meant to say that at the top of the show. I hope that everything works out, and that they'll, you know, turn around and rehire you guys, you know, or the ones that didn't get rehired got another job, because they're families and things, okay? And then you got kids that are in school that on grants and tuitions and things like that, you know. Now they have to reapply. Some of them have to reapply for these grants and stuff that they were already given. So I just want to say, I take my hat off to you, and we say good night. Just me.
I tell my son, "I love you," every single day. Now, my dad has never said that to me. Not because he doesn't love me, but because culturally it wasn't comfortable for him. Now that he's a grandfather, he says, "I love you" to my son every time he sees him. My advice to all the fathers out there, forget the cultural restrictions. They grow up way too fast for you to waste even a single precious moment.